Hello, my name is Riley. I just finished my EMT Basic course. Uh, I passed all my tests. Now I'm just waiting for my national registry, so like my certification test. I wanted to publish some information that may help people giving emergency medical care in situations like protests. So let's hop straight into it. I want to put this video into two different parts. So the first part will be general EMS basics, emergency medical system basics. Um, just things you need to know before you do anything to anyone, right? And then we'll go over protest specific stuff. Specifically, tear gas is what I get a lot of questions about, but we'll go on to some other stuff too. So, as an EMT, I'd say the most important thing we learn is ABC, uh, something we use when we address every patient ever. Airway, breathing, circulation, magical, right? Airway is making sure that they have a way to get their air into their body. Yeah. So when you breathe, that air goes somewhere, right? Say my throat is clogged up with a foreign body. I'm inhaling, but the oxygen is not getting past that foreign body, right? I don't have an airway anymore. So that's a big thing for EMTs. Honestly, for civilian medics, quote, quote, that's not really going to be something you can handle extremely well, and I don't think it's something you really run into. Second thing, breathing, B. That's making sure they're actually getting oxygen in somehow, right? You can address that, actually. I would suggest you do it with a pocket mask of some sort. I'll put a picture of that up here, or a back valve mask. Put that there. And those are two devices we can use to assist people in breathing. Now, as a civilian medic, we're not going to go super into detail about like how often you should be breathing for them or how much oxygen you should be putting into them. Just try and breathe for them like once every 5 seconds, and you'll be doing pretty well. Next, circulation. So blood flow. That's getting oxygen to where it needs to go through the blood. Because blood, essentially, for our purposes, is just liquid oxygen. That's what it is, right? Carries oxygen to different parts of the body. I breathe in, goes to my lungs. My lungs, that air is processed in the lungs, put into the bloodstream. Heart pumps it out through the body. That's how it works. If the person is not circulating, getting blood, liquid oxygen, to the place where it needs to go, things aren't good, right? So the one thing you can really do to ensure that's happening is control blood loss. Stop the bleed, right? Say someone has a gash right here, right? Someone has a gash on their arm, and they're bleeding all over the place, right? First thing, apply direct pressure. Try and make the bleeding stop that way. If not, then you're going to go with a tourniquet, high and tight, higher than the injury and tight. And that's just going to make sure that that blood will not flow to that area anymore. The reason we do that is because, once again, blood is liquid oxygen, right? If we lose all of our blood, then it doesn't matter how much we breathe, our oxygen cannot be transported through the body with blood. So that's why people die when they bleed out, right? So your priority is to get them to stop bleeding, because that addresses the C in ABC, airway, breathing, circulation. Other EMS fundamentals you need to know are BSI, scene safety, body substance isolation. Basically, just making sure you, as the medic, are safe, right? You have to ensure this because other people are going to need you. So you always have to come first. You have to make sure that you're not getting any contagious diseases or spreading them around. Coronavirus is a big one right now, so don't do that. But take all precautions necessary. Wear a mask. Wear gloves. If you're wearing gloves, you can't wear gloves and then turn off the light, turn on the light, go to the bathroom, drive your car, touch your face with the gloves. Then there's no purpose of the gloves, right? You wear the gloves. You work with the patient, and then you take the gloves off, you dispose of them, you put on another pair of gloves. So that way you are not cross-contaminating other things. Yeah. And make sure you're washing your hands. That's a million times more helpful than the gloves by themselves. So yeah, body substance isolation. Make sure that you are not getting sick, especially in times of an infectious disease like we're in right now. Make sure you are not getting sick and then giving that sickness to other people. Even if you aren't concerned about coronavirus, your neighbor's grandma might be. So try your best to not be an idiot. Body substance isolation. We always say don't become the patient. So don't. You can also do that in cases of like a lot of blood loss. like if you're going to be out at these protests as a civilian medic, like that's what you want to do, bring sunglasses, bring a lot of gloves, bring a couple of masks, bring oxygen devices, which we've talked about and I'll probably address again later. Make sure that you have a surplus of these things because you need them. You're going to interact with several people, right? If I interact with a patient who's been tear gassed, I help them, as we'll talk about later, how to do. Then I'm using my gloves on them. Great. I haven't touched my face. Great. I go to my next patient wearing the same gloves. I'm touching up on their face, helping them with tear gas, right? Now, I have definitely infected the second patient with whatever the first patient may have had if I'm dealing with their eyes all the time in the same gloves, right? So have lots of gloves and change those gloves. You're not doing these people any favor if you're giving them viruses, even beyond coronavirus. We don't know what people may have or may not have. So be safe for you and be safe for your patients. So we've gone over ABC, airway, breathing, circulation, BSI, body substance isolation. Yeah, I think that's all the EMT knowledge basics you need to know, because this isn't dealing with like EMS, emergency medicine as a whole. This is just dealing with protest situations. So let's hop into the good stuff. Tear gas. That's what everyone seems to want to know about. Tear gas is a formulated material that law enforcement may or may not use to make you not want to be there. It's not a pleasant experience, right? We can combat tear gas, though, like the effect that tear gas has in the body. And we do not want to do this with milk. /milk. It will be much preferable to use saline. And saline is not a rarity. Saline is salt water. It's just salt water. It's big boy medicine is salt water. The formula or mixture is 500 milliliters to 5 grams of salt, I want to say, but I'll put the correct formula right there and in the description. And you're going to mix that together. And now, the reason saline works well is because it has the same makeup approximately as the blood does, right? So, as most of the things in our body do. So when we flush the eye out with that, we're actually going to get the contaminants out as well as not make the body fight the saline as well. Yeah. So if you're using milk, the body obviously recognizes that it's not something from your body, and instantaneously the body makes efforts to work against that substance. Even though you have flushed out the tear gas, you are now working against another substance, even though you don't really need to be, right? With saline, the body will not usually recognize that saline is not part of bodily fluids, and therefore will not fight against it nearly as much as milk, and therefore it is a better agent to use to clean out the eyes. You're basically going to take their head, tilt it, take the eye, take your saline, and flush it across their eye. You're going to have to hold their eyelids open. It's not a perfect world. Hold their eyelids open for them. Please wear gloves, a different pair of gloves for every person you may have to treat. You're going to hold their eyelids open, put the saline right there, and let it flush out their eye. It's very important that you don't do it like this, because it could very possibly go over to the other eye. Now you've been flushing out that tear gas into the other eye. You've effectively done nothing, right? So you use that saline, push it one way, and then do it the other way, right? And once again, saline is glorified salt water. We already talked about controlling bleeding, but once again, make sure you've tried direct pressure first, and then go with the tourniquet. Remember that you are not definitive care. Even I'm not definitive care. Even paramedics are not definitive care. We are not what's going to make them better in the long run. But to keep them from dying, or to make them better from things like tear gas in the immediate sense, we have to address certain problems on our own, like bleeding with a tourniquet, right? Do not use a tourniquet if the bleeding is under control. Do not use a tourniquet if the bleeding is under control. If they're not bleeding excessively, don't slap on a tourniquet. You don't have to. I saw a very discouraging video of a bunch of protesters rallying around someone who was not bleeding. He just had a cut on his leg that had seemed to have sealed up, and they applied a tourniquet. That's not only stupid, but it's very dangerous. So if you don't know what you're doing, I really advise that you don't do anything at all without the advice of a medical professional. So yeah, tourniquet when they're bleeding too much. And that's high and tight, right? If I have an injury on my forearm, I can't put the tourniquet on my wrist. It has to be closer to the chest, high and tight. If it's on the lower part of my leg, I have to put it on the higher part of my leg, etc. Do not tourniquet the neck. I hope to God no one actually thought they should, but don't tourniquet the neck, because then we wouldn't be able to get any actual blood flow to the brain, and then you die. So, let's recap. So far, we have gone over ABC, airway, breathing, circulation. We have gone over BSI, body substance isolation. Then we talked about saline and flushing people's eyes out for tear gas. And then we talked about stopping the bleed again, very briefly, right? Let's talk about some things that could happen at protests. Someone could be struck hard with something or fall on something, etc. And there are a number of things that can happen from blunt force trauma. I'm obviously not going to make you like an ER doctor here. But if someone hits their head very, very hard, they could end up having a seizure. Or if someone is epileptic, they could end up having a seizure. If someone has low blood sugar, they could end up having a seizure. People have seizures for lots of reasons. We need to know how to address those seizures if we have any faith in calling ourselves anything of a medical personnel, even if that is just a civilian medic, right? So seizures, basically, they are just the brain freaking out. It's the simplest way to put it. We can't do a lot about this in the field. Paramedics will give them a drug called benzodiazepam or a number of other drugs that can just stop the seizure. Obviously, you nor I have access to those drugs, right? So all we can do is make sure they don't hurt themselves. Don't put anything in their mouth. If you value your fingers, don't do a finger sweep. Don't touch their mouth. Make sure they're not banging their head against anything if you can, and don't touch them otherwise. Time the seizure. Once a medical professional gets there, they're going to want to know how long the seizure was. A big thing with seizures is the post-ictal state. Post-ictal state. That's after they seize, they don't just get up and say, "Hi, did I just have a seizure?" No. They are going to be semi-conscious in a way. And they're not going to be able to talk to you, etc. They'll be breathing. They just won't, and often their eyes are open, but they won't be able to speak with you in a coherent conversation. We call this post-ictal state. You want to know how long that was too, especially relative to the seizure. So your job in a seizure basically is to make sure that you don't let them hit their head on anything, and you time the seizure and the post-ictal state, how long they're not acting like themselves after. If they are seizing because they hit their head very hard, that's really bad. If a seizure is caused by trauma, that is obviously it's really bad, but that means the brain is freaking out. Like the brain was hit hard enough for the brain to have its own neurological reaction. No good, right? Definitely a 911 call. If you think you should call 911, don't think too hard about it. Just call 911. That's first responder's job, to show up and help, right? Yeah, so that's seizures. That's all I've got. I hope you enjoyed. If anyone's got any questions, feel free to leave comments. If anyone has suggestions for more content, I think I'll be making like EMT review videos. While I'm studying for my national, I may as well. So I'll be making like different chapters with some slides hung up. It'll be kind of comedic. We'll see how that goes. So thanks for watching. Let me know if you need anything, any questions, or anything like that. Thank you very much.